Thank you for sticking with us and welcome back. So polio it's a lethal disease. It causes disability and it doesn't have a treatment, but it can be vaccinated against. And one major concern with vaccines is normally when it goes wrong, and it causes paralysis in some other cases when one is administered with either the wrong or expired jabs, and say, which is a case that has happened before. And our reporter Omo Onyango had talked earlier on to one victim of a similar circumstance. We now take a look at the story and then we'll be back with our discussion regarding the Polio Day 2018.
At first, everything about Abby Kamau's baby girl seemed normal. She met every development milestone and delighted in every discovery. But at around 3 months, Faith Kamau was given an expired vaccination in which she was the only survivor out of all the children who got the deadly jab. She started regressing, and by age 2, she had fully retreated into her own world. She no longer made eye contact, nor seemed to hear. The trips in and out of various hospitals for the past 22 years has been countless.
That is when she was given an expired vaccination. And the children who were vaccinated with her then, most of them died. So since then, I've been in and out of hospital. She was like just a baby born child. She had not gained strength even to sit, or even the neck had not held. So this happened at 4 years. This is when she was able to sit. She walked at 8 years.
Abby is at pains trying to explain to us how the journey has been and the friendship the condition of her only daughter has cost her. But she says that prayers, her husband, her colleagues and her closest family members have been supportive.
So most of them, they are never there for me. But there are others who are loyal. Most people don't want to be near me because she's screaming, and even the house girls, those who have not had such an experience, they just can't stand it. It's like a drama, everybody is standing to you like this is not a human being.
But she's optimistic that her daughter who loves singing will be able to defend on herself someday.
How excellent is your name. How excellent is your name.
So as you saw, right, there very many things can go wrong. But as we approach the World Polio Day, we are here to demystify all that and to just give you the confidence that your child really needs to get that vaccine. And there's an article that was on the Star newspaper by Nancy Agutu on the July 19th, 2018, where mothers whose children were given the newly upgraded polio vaccine took to social media to express their worries about outrageous symptoms. So with me in studio today, I have Lilian Mutua, who is the Nairobi County Health Promotion Officer, and Joseph Ndegwa, who is a polio survivor. That's right. So let me just go straight to it. What are some of the symptoms of polio? I'll start with you, Lilian.
Well, when one has the polio, once you get the polio virus into your body, you suffer the disease polio, which is first irreversible. So you'll either end up with paralysis of your arms or your legs,
right,
or it can even happen to both of them, the arm and the leg. And further to this, it even becomes more fatal when the virus goes into your spinal cord,
right,
making the brain paralyzed, and so it can also cause death.
Right.
So the people who survive the disease are the ones who end up with paralysis.
Right.
But those who get severe infection, which also includes in the spine, then these ones die. The way you get polio is through contamination.
Right. So before we get into the ways in which someone gets polio, the symptoms are only visible in 90% of the infected people. And with me in studio, I also have Joseph Ndegwa, who is a survivor of polio. So, sir, tell me about the 90%. Do you consider yourself lucky to have been part of the people on whom the symptoms were visible in such a way that it was capped? How has your story been?
Kwa majina naitwa Joseph Ndegwa. Hii polio ilini affect wakati nilikuwa na miaka 4.
Right.
Kutoka hiyo wakati nimesurvive tu kama watoto wao wengine. Nilikuwa nikitembea kama watoto wale wengine, lakini baada ya hiyo miaka 4 nikapatwa na polio sababu sikupata injection. No, hii chanjo inapewa watoto ya kuzuia hiyo polio, ndio sababu nilipatwa na hiyo polio. Na nimekaa naye kwa since hiyo kuanzia hiyo miaka 4 mpaka saa hii niko. Na nina survive na I hope na ninaomba Mungu sababu haikuniguza spinal cord, sababu ikiniguza spinal cord ige paralyze mwili yote. Lakini iliguza mwili, mguu ikaumiza yote. Lakini saa hii tunahimiza hata watoto wapewe hiyo chanjo sababu wakikosa kupewa wanaweza kuwa kama mimi.
Ilikuwa something preventable, that's right.
Yes.
So let me push this to you, Lilian. And the Ministry of Health has confirmed the existence of polio virus in the country. What is the situation in Kenya right now?
Normally what there is that every 2 weeks there is sampling through the sewer systems in designated points, not only in Nairobi, but in the country. So when we isolated the polio virus type 2 in our sewer in Kamkunji, that is in 10th Street, then we had to call for a campaign. Because if there's anybody who has the polio virus that is circulating, then it means especially those who don't have full immunity are at risk. What I'd like to also inform the public is that the vaccines that we are giving right away, like the ones we use in our clinics, the oral polio, the drops, we only vaccinate against type 1 and 3.
Right.
That is that vaccine that we are giving right now. Over a period of time, world over, the polio type 2 has not been gotten anywhere. But when we realized this, then we had to get the vaccine for type 2 manufactured, brought into our country so that we can give. From 2014, we have not been giving immunization against polio type 2. We use what is called the bivalent. But when the child gets to 14 weeks, they get the injectable polio. Now that is the one that has the combination of the 3, type 1, 2, and 3. Right. So we have 3 different strains of the polio virus. This type 1, 2, and 3. Right. In the injectable, we use now what we call the trivalent, which has the vaccine for the 3. For the 3 types. But the one we were using in from June, July, and August, that one we were using the monovalent, which is only for type 2. Right. After we gave this in August, it has been withdrawn from the system. Right. Yes. Because it's now not relevant. There isn't that much strain of polio out here anymore. Not that it's not there, but when we look at from 2014, we were not giving against type 2, which means the children who are getting the oral polio type 1 and 3 didn't have any defense for that. Right. So we had to now jumpstart and give them for that because now it was circulating in the environment. Right. It's not a person who had suffered, but we got the virus from the sewer, which means it could be around. Right. And the Ministry of Health has confirmed the existence of polio virus in the country. And this is something that I mentioned earlier on. And in February 2016, again, Kemri destroyed the remaining stockpile of one of the polio virus strain that was type 2, as you mentioned earlier on. So prior to that, Kenya was really much hoping. Kenya was so much hoping to be certified as a polio-free country this year. And this effort was squashed by this particular discovery by Kemri. And earlier this year, again, there was another strain that was found in sewers in Italy. So, Joseph, acha nirudi kwako. When you hear somebody say a polio-free world, what does this bring in your mind?
Kuwa na furaha sana sababu wakati wetu kama tungeambiwa tukunywe hiyo polio tungefurahi sana hata sisi. Na nafurahi sana nikisikia ati kila wakati kuna polio free, kuna polio free, kuna polio free. Naimiza watu wote wajitokeze na wape watoto hiyo polio sababu ili kusitokee jango kama yangu.
Ili tutueleze yale madhara ambayo polio has had on you. Talk to us about, I'm seeing you're using crutches to walk.
Crutches natumia sababu kwa ajili ya hiyo polio. Initially nilikuwa naenda na ile mti kubwa. Baadaye ndio nilifujika hii mguu yangu ile mzuri. Nikabadilisha hizi crutches. Sasa si unaona uko na polio halafu umefujika mguu. Sasa si unaona how difficult you have now. Sasa hizi ndizo tunataka kuhimiza watoto wapewe hizi vitu ili wasipitie zile difficulty tunapata sisi watu wale wako na miti. Kuna zingine affect hata ina affect miguu yote. Ingine inaweza affect mkono na ina affect mguu. Sasa si unaona huyo mtu hata mkono yake kuna wale hata haifanyi mkono haifanyi.
That's right. So let me push it to you, Lilian. Let me just ask, when it comes to issues such as these effects of polio, paralysis has been the main one. It's the main one that is mentioned and so on and so forth. And even Joseph is just trying to sensitize against that if a vaccine is given in time, you can actually prevent that in children. So tell me about the side effects of polio, especially for someone who now grows with polio.
Okay, when you grow, if you're a polio survivor, you have gotten the disease, but you have survived.
Right.
It's very challenging, even if it is a child, because now this child becomes dependent on the rest of the family. At times you'll find that because of the difficulties and the challenges the child goes through, even the mother is not able to shoulder that burden to somebody else. Maybe she's a working mother, she'll have to stop working. And if it is, we've even seen it have parents who disagree because now there's a child with disability and the load is too much, then they part ways. Some people feel like it's a social embarrassment. Some people feel like it is a social misfit. Some people even think what we call the myths and misconception. People might say it's witchcraft and so on. But now when we're looking at that is that polio is there, it's real, it's around, and the only way we can have it done with is by getting the children immunized. Kenya was one of the countries that have signed through the WHO to eradicate polio from the face of the world. As much as people think that we've taken a step back, it is not a step back because we found the virus in our sewer. It only shows how vigilant our disease surveillance officers are. So the disease surveillance officers are always on the lookout. They're always on the ground collecting samples, looking at cases that are being mentioned. Maybe if there's a suspected polio disease, a suspected measles disease, and all the other notifiable diseases, so that we can up our game. When we also look at our children who are under 5, in some quarters in this country, we find that the children do not undertake their immunization as per schedule.
That should be a major cause of concern, I believe. So let me push this to Joseph now. Your operations, especially when it comes with you sensitizing people to either get vaccinated against polio and getting them to revaccinate again after they are vaccinated. How has the reception been? Unaenda pale nyumbani, how are these kids responding? How are the parents responding pale nyumbani when you go and tell them that we are here to give your kid a polio vaccine? How is the response?
Wenyewe wanajitokeza vizuri sana sababu nikiwaelezea shida zangu lazima unaona wazazi wengine wana feel, wengine hata wanaita watu wanakuja kupewa hiyo polio. Na mimi naimiza, unajua kuna wamama wanakataa kupea mtoto polio. Na unajua za zile hii mzigo imetokea ama mtoto akilema, mzee anatoroka anawashia mama mzigo. Kwa hivyo lazima mama ajitokeze wapee watoto polio, sababu nimeona hiyo shida by mimi. Nikiwa najua shida mimi nimepitia.
And that is very commendable that you are actually at the forefront of this particular campaign right here. So let me push this to you, Lilian. Where can these vaccines be found, if not for the door-to-door campaigns and so on? Mzazi ambaye yuko pale nyumbani right now, how can they get their kid to actually go and get this vaccine on the now?
We are having the teams that are going house to house, door to door in the community. We have other mobile teams that like in the CBD or in the marketplaces, the malls. We have some teams which are moving around. We also had teams on Friday, Saturday, and Sunday visiting the religious institution. On Friday, there were the madrasas. On Saturday, they visited the people who go to church on Saturday. And on Sunday, still the same happened. Today, up to Wednesday, we're also visiting the schools where we have children who are under 5. And we're also having static points, like in our clinics. So it is not only in the public clinics, even in the private clinics, we even have very good partnership with people who are running their own clinics, who are giving space for the vaccination teams to go there and reach their communities from there.
Right. And in your campaign, you've identified areas such as Nairobi, Kajiado, Kiambu, Kitui, Meru, Isiolo, Tana River, Lamu, Garissa, Wajir, and Mandera as some of the counties that are really at high risk for this particular polio virus, right there. Why so?
This is because some of these, like Nairobi, when we look at Nairobi, it's a transnational county.
Right.
It's an international hub. We get people going out, in and out of Nairobi. And we also know that maybe where they're coming from, there are people who are suffering. When we look at other countries like Wajir, Mandera, Garissa, the ones on the frontier, they have porous border points where people just go across to the other countries. And especially when we are looking at the northern part of Kenya, we know that when we were doing our round 3 here in Kenya, we also had a case of polio reported in Somalia and in Ethiopia. And even when we were doing the last round, we had a case reported in Papua New Guinea.
Right.
So when we think of how Kenya is, we have so many people who come from across. So we have to be vigilant and continue doing this campaign.
That's right.
For the last 3 campaigns that we have done, we are doing them for the Horn of Africa, where Kenya, Somalia, and Ethiopia are also involved.
Are in the front line for this.
Yes.
And let me push this now to you, Joseph. Mtoto ambaye a child who's been vaccinated against polio, is there a need for them to be revaccinated? And is there an effect that may come from maybe redoing the vaccination?
Hakuna shida, hata ukikuwa umekunywa na imetokea ingine lazima upewe, sababu hiyo haina madhara. Right. Haina madhara yoyote. Kwa hivyo kama ulikuwa umepewa ingine na ingine itokee, kunywa, sababu hiyo ni maisha yako unatengeneza baadaye. Right. So no, unajua watu wengine wanaona kama wengine wanaenda kama wanauliza easy vaccination, easy polio, shindano polio ni ya nini? Yeah. It's better to give your child to that polio. Right. Yes.
I'm actually aware it strengthens your immunity as you go, as you take more of it, Lilian. And
what we know is that once a child has been vaccinated, there is no way that you can measure how much immunity this child has built. Right. We only hope that a child has built enough immunity. But below age of 5, the immunity is still being built. Right. And if this child has already gotten adequate antibodies in the body, because that is what the vaccination does, right, then this child, if they are given more polio vaccine, it is not going to have side effects. What the body doesn't need, it removes.
Right.
Yes.
And that is a message that should really be out there. Polio does not have an effect if you take more. Exactly. An overdose, there is no overdose actually for it. That's right. And now a follow-up to a story our health reporter Oma Onyango did earlier on about a child who was given an expired vaccination. That is, how can a parent at their home know that this medicine that my kid is being given, it's safe and it has not expired and will actually help and not cause harm to this kid?
Okay, what I know is that the current vaccinations that we are using and the current vaccinations that are in our public facilities, we always look at the manufacture date, the expiry date, and the batch number. Right. Anytime, even if it is not going for the campaign, even the ones that are given within the clinic, we have to record that on a daily basis. Right. Any batch that is given out, any vaccination, the vial, has to be recorded, the batch number, the expiry date, and even the manufacture date, so that it can be followed up in case there's any cause of arousal for any complaint. Right. The vaccines that we are using have been certified by the World Health Organization, the CDC, and we also have other partners that we are working with, like the Rotary International and the International Red Cross. So with the World Health Organization being on the forefront, and the Ministry of Health,
totally no way
it is very safe.
Expired vaccination can be given.
What I know is that at times they could be taken, and this is about injectable. And what we are giving right now is the oral drops. It's not an injection. Right. In an injection, if you go to a service provider who is not an expert who is not well trained, who is not certified to do what they should be doing, then that is where maybe you'll be messed up.
There may be a complication.
So also where you're going for your services, be sure you're going to the right people who are certified to give these services and who have been trained and they have the Ministry of Health authorization to carry out the service.
Right. And now on to you, Joseph. What can we look forward to on the 24th? Tunaweza tarajia nini regarding the World Polio Day in Kenya now?
Tunatarajia mazuri sana na watu wajitokeze, sababu unajua sasa hatuwezi sasa tukafanya kitu kingine. Ikichatokea imechatokea na ni lazima watu wapewe.
Right.
Yes. Kwa hivyo ni sasa sisi kazi yetu tu ni kuweka nguvu watu wapewe polio. Na tunaenda door to door. Yes.
That's right. Don't miss out. That's what is written on your shirt. Lilian, call out for people to attend this. What will we be looking forward to on the 24th? Festivities, events?
It's not really a festivity because during this time, we will be looking at the last day of the campaign for this round.
Right.
But in the counties where also they are not doing the polio, because we've said it's only 12, we are also looking at the scale up of the routine immunization. Because this is the message that should go out there. If we knew that every single child who is born in our country has had all their immunization as the schedule, that is from the day of birth up to when they are 1.5 years, when they get their last second measles vaccine, then we would be very safe. If we get 100% of children being immunized, then we have no cause of worry, even if we get those samples in the environment.
Right. So Lilian Mutua and Joseph Ndegwa are right there. I am from a generation who has witnessed the devastating effects of polio. When I discovered how close we are to eradicating polio, I was very motivated to be a part of this movement. It is so rare when you can accomplish something so spectacular. So the words of Angelique Kidjo, who is a songwriter, brings us to the end of this interview, still calling out on you, vaccines actually work. That's right. So go get vaccinated against polio. The campaign is running until the 24th. You can also get vaccinations at various health centers across the country. Thank you very much, Lilian and Joseph.
Thank you very much.
We take a break. We'll be back with your daily sports action now.